My name is Eva Goldburn. Members of the Public Health and Children Committee, thank you for the opportunity to testify on SB2. My name is Eva Goldburn, and I live in New Haven. I have been a teacher at Hope Child Development Center for 10 years. I have 4 daughters. One is the director owner of the Hope Child Development Center. Another is the executive director of Circle. Another daughter is a freelance photographer, and the other daughter is the ethic counselor for the National Institute on Minority Health and Health Disparities. I am very proud of my children, and I am asked all the time by the old parents, what did I do right? While there is not one thing that I can point to, I can definitely say that creating a loving, nurturing, and stable environment for my children was the heart of their success. This was not easy for me to do when my children were younger. However, this is why I am able to connect, comfort, and support the parents who have to leave their children in my care at Hope. Many of these parents are new mothers, and I am the first stranger that they are trusting to take care of their babies. The majority of the time, it is the parents that I'm taking the most care of and providing guidance to as new parents. I still have parents reaching out to me for guidance and their children and for advice, even though they are no longer at Hope and their children are grown. This is a circle of security that I help to create for families. As an early childhood educator, and I'm proud of the start that I have given to all the babies that I help to nurture over the past 10 years. Sadly, as I near retirement, I do not have a retirement plan that I can really rely on outside of Social Security and my husband's pension. These are not enough to support me. While I know my daughters are always be there to help me with my needs, the industry without these assurance. Many of the providers have no assurance on industry, on insurance. We need to recognize and honor the important role early childhood educators make to the development of mental health and well-being of children and families. This year, we need $700 million down payment on what should eventually be a $2.5 billion system that will enable the people who dedicate their lives to doing this work to not have to depend on the state for assistance when they retire. Thank you for your time and consideration.
Thank you, Eva, and thank you for your service. And your testimony was very touching. It reminded me of the people in my life who helped with my children when they were young and how successful they are. I always attribute to the teachers and the caregivers in their lives. So thank you so much for your testimony, and I couldn't agree with you more. We need to make sure you and the others in your service have adequate means. And so thank you for testifying. I don't see any hands, so I'm going to move to the next.
Thank you for having me.
Thank you. Next.